Sorry guys, have no idea what just happened. It just completely shut off. That was really weird. Hey everyone, sorry, I'm just trying to get Dr. Zwickey back on. Don't know what happened. Dr. Zwickey, trying to see. Hey, sorry about that. No idea what just happened. It literally just shut off black. Like,
welcome to the country. This is what our internet does in rural areas. So,
oh, okay. So I'm blaming you, not me.
It's me. I apologize. It happens all the time when everybody's on the internet. So I was talking about Echinacea, right?
Yes, yes.
Okay, so Echinacea. Early in the immune response, Echinacea has been shown to increase pro-inflammatory cytokines. Late in infection, Echinacea has actually been shown to increase T-regulatory cytokines. And that's what you want to have happen, right? So you want to have pro-inflammatory response early in infection and when the viral load is low, and then as the viral load increases and you have a Th1 response, then you want to be able to shut things down. And that's what Echinacea does. Echinacea is also interesting for this particular infection because in animal models of stress and infection, it actually restores cytokines to their normal levels. And if we think about how this infection is like stressing everybody out, we could actually use a little bit more of that, of restoration of cytokines to normal levels. So, yeah,
I guess I'm wondering. So, is it really just the studies on increases in certain cytokines like IL-1, IL-6 that is driving everyone crazy right now? I mean,
yes.
Don't other infections like the flu also cause cytokine storms? Why all of a sudden is this people acting like this virus is coming from Mars? We've never seen anything like it, and all research goes out the door.
Yeah, no, I think there's a couple of things. I think first of all, people who are not immunologists and or not herbalists don't understand the dynamics of the immune response. And so if they spot a cytokine that is high, like interleukin-6, they immediately go, oh, then we shouldn't give that because we know that interleukin-6 being high is bad for infection. But the reality with herbs and herbal medicine is that they have multiple mechanisms. So they have the pharmacological mechanism when we think about active ingredient, right? But herbs are also acting as prebiotics, and herbs have nanoparticles, which means they are very responsive to their microenvironment. And so they change what they do as the microenvironment changes. And there's some great research out of Japan that's showing that. So I think that's what's going on. Why are people freaking out about this particular virus? The death rate is much higher. So people say, oh, well, 18,000 people die in a year in the flu, with the flu. Well, yes, and we're at a rate where we're probably going to have closer to 60 to 70,000 people die. So it's more severe than the flu.
Yeah. Back to that list just real quick. Vitamin D, that's another one that's really as a head scratcher as to why they'd be exercising caution around vitamin D.
Well, it is and it isn't. So vitamin D, I know that a couple of prominent natural medicine speakers have said, don't take vitamin D. So I have a few things to say about that. First of all, yes, vitamin D can increase ACE2 receptors. And we know that ACE2 receptors is how this particular virus gets into the cell. So your gut instinct is going to be, stop taking vitamin D. But let's think about this. Is that vitamin D's primary mode of action? No. Vitamin D regulates over 200 genes, right? More than 200. That's a lot. And so if you stop taking vitamin D, you're actually dysregulating a huge plethora of genes, including your microbiome. And we know that the microbiome is necessary for creating your Treg response. So I don't want to stop taking vitamin D because we know that we need it. in order to have a decent immune response to virus. Secondly, vitamin D is a natural product, and it's not just vitamin D, it's the vitamin D receptors that are modulating, and it's not an on and off switch. It's a rheostat, right? We turn things up a little bit, we turn things down a little bit. So it's trying to create balance, and it works in a really complex feedback loop. So am I going to recommend again that we stop taking vitamin D? No. And then the last thing is, of course, we know that 90+% of Americans are vitamin D deficient. So here we are where we need to have a decent immune response, and we can't do it without vitamin D. And yet we've now told people not to take vitamin D. So I'm a proponent of taking vitamin D and vitamin A, even though I know that vitamin A can also upregulate ACE receptors.
How strong is the research around them increasing those ACE receptors? Is it like a really definitive thing, or is it just like a couple studies that came out around it? Or?
No, it definitely does. It definitely is true that they do increase the ACE receptors. But what you got to remember with ACE2 is that ACE2 is both on the surface of cells and it's soluble. And soluble ACE2 receptor is protective, right? Because if virus binds to soluble receptor, then it's not doing any damage to a cell. So vitamin D is actually increasing soluble receptor. It's protective versus pathogenic. So again, complex feedback loops, and
yeah, and I guess that answers a question, you know, that someone brought up as well. Is the increase in ACE2 receptors actually protective? And I guess if it's soluble, then yes. If it's membrane bound, then no. Right?
Well, yes and no. No, membrane bound ACE2 receptor can increase viral load. However, remember that when you signal through ACE2 receptor, you're increasing a variety of ACEs, ACE1 through 7, I believe it is. And those are anti-inflammatory, and those help with bronchial dilation. So you want to signal through ACE receptors, so your body's probably upregulating ACE2 receptors so that your lungs can fully dilate and you can breathe in a viral infection that's blocking lungs.
Wow. Okay.
It's complex.
Yeah, it's not so easy. Since we're just on the topic, I just wanted to ask about the ACE inhibitor drugs and the ARB drugs increasing ACE2 receptors. Are they just increasing the membrane-bound ones, or is also the soluble ones, or how are we thinking about those drugs affecting ACE2?
Yeah, so we're thinking about them increasing membrane-bound primarily. And could they be protective? Hypothetically, that's not what we're experiencing right now clinically. Right.
It would make sense that they're not. Okay, good stuff. So back to general public question. Can you speak to the idea of multiple strains and that a strain may have been around the population since the fall?
Yeah, that's a good theory that's out there. It's possible. So we know that the reason that this particular coronavirus is more pathogenic than SARS and MERS is that one of its receptors has a furin binding site, which allows the virus to get closer to the cell. Now, how did it get that furin binding site? It's possible that you had a less pathogenic strain that was circulating in the fall, and it mutated to develop this binding site, and now we've got a highly pathogenic strain. It's really hard to say what was going on this fall. There are a number of people who had what really looks like this infection in the fall, and they weren't diagnosed because at the same time with influenza, we were seeing an influenza B strain circulate, and influenza B is not one that usually circulates. Usually we get influenza A, and so people were getting really sick with the flu, and they were being diagnosed as, oh, you must have the flu strain B, instead of being diagnosed with a coronavirus. So while we didn't have any testing, it's entirely possible that it's been around longer.
Wow. Okay. So this is an interesting one. So the president made a statement on Saturday that hydroxychloroquine, Plaquenil, and azithromycin should be used as a treatment. What are your thoughts on it being used, these drugs used as a preventative? I know there's been like a run on these drugs now in pharmacies, and there's shortages going on. What are your thoughts?
So I'm personally not a huge fan of hydroxychloroquine for the average person. I've seen it used for malaria in Tanzania, and it's pretty nasty. I don't like the side effects. So for high-risk populations, maybe. Certainly the in vitro data suggests that it blocks the virus from binding to the ACE2 receptor. So that's why people are scrambling to take this. But, you know, for the average person being someone under 60 who's in good health, eating a good diet, you know, those sorts of things. Maybe that's not the average person. Anyway,
yeah.
For those sorts of people, I'm not going to say go take hydroxychloroquine. I'm going to say get your gut in order, you know, like that's going to be as effective at you surviving this viral infection because you're not a high-risk person.
What about
possibly
high-risk
people?
Yeah. So for like the elderly with comorbid conditions potentially?
Exactly. Yeah. Yeah, and then the other thing to remember is that what's the tree that hydroxychloroquine comes from? The quinola tree,
yeah.
I think it is. And so there is a natural version of this, and you may try a natural product as opposed to hydroxychloroquine because it's going to have a lot less side effects.
Mm-hmm. Yeah, I think it's available in tincture and supplement form. And azithromycin, yes. I'm guessing just as a preventative for bacterial pneumonia that potentially
exactly right.
On, yeah.
Mm-hmm. Yep.
Okay. This was a thinker. Should healthy individuals try and get the infection and then self-isolate for 2 weeks? Can you get it multiple times?
Yeah.
So, I'm curious about how you would respond to that.
This is a hard call, right? So I've had this. So I got this about 3 weeks ago, and I've been through it. Oh, wow. And I would say that the lung issues are no joke, right? That this is not just an easy thing to get, and that you just go, woo, great, now I'm immune, because there are some pretty nasty symptoms. That being said,
were you tested in Oregon and were tested positive?
No, I wasn't tested because there's not enough tests. I just had all of the classic symptoms. Mm-hmm. I had the fever, I had the cough, I had the lung congestion. I had it. Wow. And I'd been on 6 airplanes. So, and in 6 different airports. So yeah, I'm sure I was exposed. Mm-hmm. That being said, what's our possibility of long-term immunity? There are some doctors in China who have been treating this virus for months and who now in March don't have long-term immunity, at least as measured by IgG. Wow. Is there a possibility that something else, maybe because it was a high stress situation, that they didn't develop long-term immunity for that reason? Maybe. Is that indicative of what's going to happen for the rest of us? Hard to say, right? I certainly hope I have long-term immunity. I certainly hope everybody who gets infected has long-term immunity. But until we actually develop an antibody test to test for our antibodies to demonstrate immunity, we don't know.
How long did you have symptoms for?
So this is me, and I take a lot of herbs, and my vitamin D levels are in their 50s. So I was actually sick. I had a very high fever on Monday. By Tuesday, my fever was gone, but I still had the cough and the chest congestion, and the chest congestion was gone by Saturday. So I had it for 5 days, but I take Echinacea, astragalus, elderberry. I take all of these herbs, and once I got it, I started taking calming herbs. So Melissa, passion flower, ashwagandha, and
did you continue those other herbs, or were you continually taking them throughout the illness?
I took the other herbs at a lower dose throughout the illness, and I took the herbs that inhibit the inhibit the NLRP3 inflammasome at a higher dose once I passed the fever. I kept the antivirals through the fever stage. Personally.
Those calming herbs are inhibiting the NRLP3 inflammasome, right? You said Melissa.
They do inhibit, yeah.
Wow. Okay. And then also elderberry does as well, right?
And elderberry does as well. Yeah. Mm-hmm. Yep.
That's awesome. Well, I'm glad you're healthy and you got through that.
Me too. And I know there was a question on vitamin D dose.
Yeah.
I can't really answer for any individual what their vitamin D dose should be, because I don't know what their vitamin D receptor SNPs are and how much they're actually absorbing. What I can say is get your vitamin D levels tested, find out what they are, and get them into the 50s. And then have your daily dose. If you feel something coming on, what I do is I take 25,000 units and I just, whomp the heck out of a virus, and then I take it once. Then I don't take it the rest of the infection. So
you just do a one-time 25,000 IU dose.
I do, and then I just take my normal daily the rest of the time. Yep.
The normal daily dose, continual dose around.
Yeah, for me that's 6,000 units. So whatever it is for whatever individual.
Great. This is an interesting one too. So if you have a common cold or flu, and you're currently dealing with that, and then you come in contact with a virus, are you at greater risk of developing a more serious illness?
Hypothetically, yes, because you already have activated that inflammasome and now you're going to activate it again. So hypothetically, yes, we haven't heard that. What we have heard is a number of people developing coronavirus and then getting the flu. So that seems to be the more likely scenario. And then the flu does tend to be more severe as well. And those folks are going onto respirators. And actually, the big discussion is whether or not you put those people on hydrocortisone or steroids to actually slow down the immune response at that point.
Mm-hmm.
Yeah.
Questions on vitamin D. So this is actually something I hadn't heard before. Vitamin D decreases cathelicidin. Cathelicidin, sorry. I hadn't heard that. And that cathelicidin is an antimicrobial and protective. And that it also might inhibit NRLP3.
Yeah, so just got the arrow wrong. Vitamin D increases cathelicidins, which are a type of defensin that are in your gut and on your skin. And vitamin D actually increases it through production of interleukin 22. And then it also can decrease the NLRP3 inflammasome. Yeah.
Okay. So someone was a little confused there.
Yeah.
So fever in the immune system. I got some questions on fever and when you would jump to a fever reducer. Fever is super protective. It's the way that boosts. It's the way that the white blood cells are getting a boost through. They're more activated during times of fever, right? And so
yeah,
you don't necessarily want to cut a fever down, but then if it's causing headaches and some discomfort, you would. So what are your thoughts on that?
So I kind of go along with the theory that, fever is being induced by your pro-inflammatory cytokines, IL-1, IL-6, TNF-alpha, and you want to have those on hand for the first 2 or 3 days. So having a fever for 2 or 3 days is absolutely fine. When your fever gets to over 103, then you want to seek medical attention, 103 or over, I believe. And the other thing that you can do to keep your fever kind of a little under control is, of course, hydrotherapy, right? Lukewarm bath water, which feels so good when you have a fever. So it's something that you can pretty much do with home remedies.
Mm-hmm. Great. Good reminder on hydrotherapy. I think we tend to forget it and jump to other things. Hydro is so important.
Oh, yeah.
Around that, though, there's been some controversy around NSAIDs, particularly ibuprofen, and potentially increasing ACE2 receptors, and then Tylenol depleting glutathione. I know you and Dr. Tina Moore talked about this on the podcast. And any further thoughts on kind of maybe the best or the most ideal NSAID to use at this time?
So, if you want to go NSAID, willow bark, of course, is the classic natural NSAID, but it also is going to decrease the cyclooxygenase enzyme. So at that point, now, is it any better than a drug that does it? Willow bark has over 300 ingredients in it. So, you know, what else is it doing? It may be doing something positive. We just don't know. It hasn't been studied. One of the things I like to think about is how else are you reducing inflammation? So we think about ginger and turmeric, but we also think about fish oil and SPMs, which are those, what are they? Specific pro-inflammatory mediators. These are the resolvins. These are the things that help slow down the immune response at the end of a immune response to a virus or anything. So I would think more about taking resolvins or fish oil than I would about taking an NSAID at this point.
Very interesting. Great info there. Let's see, back to the doctor questions. So this one was about elderberry. We had talked a little bit about elderberry, kind of being the ideal candidate right now. Dr. D. Nicolantonio came out with some research on nutraceuticals. I was wondering if you had any thoughts on his paper or some of his recommendations.
Yeah, so I think spirulina, which he recommended, is fantastic. Again, we're seeing both immunological effects and we see that it has microbiome effects, and having a healthy gut, you know, this is ideally naturopathic. This is our terrain. So absolutely with the spirulina. Selenium.
Sorry to interrupt you. Would something like chlorella be just as effective, or is spirulina unique in terms of?
Spirulina has more fiber than chlorella, but other than that, they're similar in their activity. So, you know, either one. Probably better. I mean, spirulina tastes terrible, but chlorella doesn't taste that much better. So find it in a capsule form as opposed to, you know, buying a bag of powdered spirulina, which I've done, and then adding it to smoothies. Ew. Let's see what else. I believe selenium was another one that was mentioned in that particular paper. Agree, selenium is fantastic for this infection. However, remember that high doses of selenium can cause prostate cancer. So we're talking about something that you would take during the infection and then not take it so much, right? So, and I say this because a lot of times as docs, we know these things, but when the public is listening to a podcast like this, they run out and they take a whole lot, because if 10 is good, 100 is better.
Right.
Not necessarily the case. For a lot of these things, there's an ideal dose, and that's why I would recommend that you work with a naturopathic physician to find out what's going to be best for you, especially if you are on any medication at all, including birth control pills. That counts, right? Including Ritalin or Adderall. All those things count. And talk to a naturopathic physician who understands drug-herb interaction. We have a really unique place in time right now in that the president has allowed licenses to go across states, and all the naturopathic physicians I know are doing telemedicine, and they can answer your questions. So I absolutely think that we should acknowledge the people who have the knowledge.
Yes, I agree with that.
You should.
So it was zinc as well was mentioned in his paper.
Yep.
He mentioned elderberry, spirulina, NAC.
Yes. NAC, especially for the lung congestion, you probably don't need to take it in advance.
You wouldn't take it preventatively?
I wouldn't, but you know.
Glucosamine, we also mentioned, that was a new one for me, glucosamine.
There's a lot of muscle pain that's coming along with this.
Okay.
Body aches.
Yeah. Circling back to, I've actually had this question a lot from both the practitioners and from the public, is using herbs like elderberry, echinacea, which are immune modulating, in cases of autoimmunity as well. So if a patient is autoimmune, would, you know, increasing some of these pro-inflammatory cytokines, you know, be beneficial for them? You know, Dr. Mark Hyman said, no, like anyone on these who has autoimmune conditions should stop right away. So what are your thoughts on that?
You know, 10 years ago, I would have said the same thing. What I'm seeing right now, at least in the animal studies, is that in autoimmunity, they aren't increasing those cytokines. In autoimmune models, they're actually decreasing cytokines. And this probably goes back to the microenvironment.
Wow. Okay, that's really good to know. And then the other question around autoimmunity is does being an autoimmune patient automatically put you at higher risk?
You know, it's a great question, and I don't think we know the answer for sure yet. However, we're not hearing from the front lines, other than diabetes, we're not hearing from the front lines, oh, autoimmune patients are showing up at our doorstep left and right. So theoretically, that's a good thing, right? Now, what could be going on? A lot of times autoimmune patients are on a drug to help decrease their immune response. And so they're not having the cytokine storm that other people are having. That's one possibility. I don't know what else could explain the fact that we're not seeing huge. We're also not seeing a lot of this in asthma, right? It's not like asthmatics are knocking down the door saying, hey, we're having terrible disease. And that could be a Th1, Th2 balance, that they already have a Th2 response going on in their lungs. And so that shuts down the Th1 from developing a cytokine storm.
Yeah. Yeah, you mentioned that with Dr. Tina. I was curious about that because I know that the WHO does list asthma as a potential comorbid condition with this. But I guess it's just, they're just worried about potentially any lung disease, but there's no real evidence, you're saying, for that.
Nothing coming out of China said that anybody with asthma had any higher risk.
Yeah. Okay, good to know for the asthmatics listening. This question about heat shock proteins, maybe I'll skip that for now. This patient here is, she's like, I'm from the Caribbean island of Grenada. Here, many people are saying that we have a low rate of infection because COVID doesn't like warm and tropical climates. Is there any truth to this? And will warmer weather and UV exposure in the summer months potentially protect us?
We wish. So here's what usually happens in warmer months. A, your vitamin D levels go up, so because you're outside more, and that's protective. B, what we see with respiratory droplets is that in warmer temperatures, they drop faster, right? So that you don't actually spew them out and they don't hang in the air like they do in cold. So you would think, as many viruses are seasonal, that maybe COVID-19 would be seasonal too. However, if that were the case, we would not be seeing the spread that we are in Africa. And what did they, I think they say 31 out of 54 countries now have COVID spreading in sub-Saharan Africa and in Saharan Africa. So, so the evidence is not pointing to the fact that it's going to go away in the summer. The other thing, and I think I mentioned, I can't remember if I mentioned this, I've been on like 4 podcasts now, so I don't know if I mentioned this with Dr. Tina, but in all likelihood, the behavior of coronaviruses is that they come back in the fall. So we may see a resurgence in the fall, and I just want especially docs to be prepared for that.
Yeah, something we're not thinking about right now, and
sorry,
we'll keep our fingers
on the front lines.
Fingers crossed. This is an interesting one. Some newer research that I read around the virus manipulating mTOR pathways. And
so could you target it?
Yeah, targeting mTOR through NAD, through fasting, could potentially lower viral replication. It could be a good strategy. What are your thoughts on that?
Yeah, hypothetically, it could. It could. We know that fasting, not for this virus, but for other viruses, we know that intermittent fasting, one day on, one day off, is ineffective. It actually increases a pro-inflammatory response. But if you do a fasting where it's 2 to 4 days, then you see a decrease in the NLRP3 inflammasome. So, so that type of fasting seems to work better. And that would.
What about an intermittent fasting where you're doing like 16 on, 8, or 16 off, 8 on, something like that?
No research on it. Not for infection. Yeah. And I think that's the more straightforward way to do intermittent fasting. but here's the kicker, and I think there was a question about ketosis as well.
Mm-hmm.
It turns out from a ketosis perspective, hydroxybutyrate can decrease the NLRP3 inflammasome. So acetoacetate doesn't, but hydroxybutyrate does.
Mm-hmm.
So even if you are not fasting, but you're getting your body into ketosis through ketogenic diet or something like that, that appears to be positive for an antiviral action.
Wow. Super interesting. So you specifically would need to be in ketosis, though. You would potentially need to be checking to see if you're there.
If you have hydroxybutyrate, yeah.
Yeah. Or taking exogenous butyrate.
Or taking exogenous butyrate. Mm-hmm. And remember, exogenous butyrate is also driving a Treg response, which is what you want.
Awesome.
You want to be able to resolve the infection.
Yeah. So other strategies of potentially affecting the mTOR pathway, like rapamycin or NAD, things like that.
I'm sure those are being tested. You know, I think that, well, you know, they sequenced the genome, and then they, scientists sequenced the genome, and then they came up with a list of potential moderators of this virus and came up with over 72 different things. I think that we would see the same thing in natural medicine, and we just haven't done it, right? But let's think about when we did this for HIV. I worked with a traditional healer in Tanzania, and he had come up with 5 herbs that he was using as a tea for people with HIV. And at the point that I was working with him, he had people who'd been alive for 22, 25 years just drinking this tea. When Muhimbili University in Dar es Salaam started screening all the herbs in Tanzania and looking for activity against HIV, they discovered over 400 herbs that had activity against HIV. So we're going to be in the exact same boat. There's going to be a whole combination of herbs. Probably you're going to want to take things in combination and not take them individually, because of the synergistic effects, because you're both trying to affect viral pathway and you're trying to affect immune response to virus and put the two things together. So likely we're going to need combos in order to have an effect on this particular virus. I use HIV as an example because this is a retrovirus. And while we always like to compare it to flu, a lot of the characteristics of this virus are very similar to how HIV works, how it inserts itself into the genome and whatnot. And so looking at some of the lessons we've learned from HIV, I think is going to be critical.
Well, that's really exciting. So there's some hope in the future.
Oh yeah, I have lots of hope.
Some questions around the best supplements for prevention. I guess, you know, Dr. Anderson talks about this virus in terms of, okay, there's the preventative phase, there's the either you're tested positive or you have all the classic symptoms of the infection phase, and that's early flu-like symptoms and moderate flu-like symptoms, and then you get to the point where your vitals are no longer stable, you are having trouble breathing, and you need to be admitted to a hospital. So potentially you can be treated all up through there, and, you know, ideally hospitals don't want to get overrun with people with just mild flu symptoms. So what are your thoughts on those kind of those phases in terms of nutraceuticals and herbs in that early prevention phase versus more in that kind of, you touched on this a little bit already, but just maybe a recap.
Yeah, no, I completely agree with them. I think that we have our preventative phase where we're taking antivirals, we're taking herbs and things, also keeping our gut super healthy, right? Sleeping enough, keeping our stress levels low, those sorts of things. But really setting the terrain so that if you are infected, your immune system is ready to go. Then you get infected and you're in the pro-inflammatory phase first, right? Where you actually want an inflammatory response. We don't want to take our inflammasome to 0 or we're never going to fight the infection. So we actually want an inflammatory response initially, and then we want to move into a Th1 response and fight the infection. And then we want to resolve the infection ideally and develop memory. But if you don't resolve the infection, now you're moving into a phase of acute respiratory distress. And that's really when you need to seek medical attention.
Great. So in terms of strategies, some of the things we talked about, potentially vitamin D, vitamin A, vitamin C, in those earlier stages, some of the herbs you mentioned, Echinacea, elderberry, astragalus, and then moving towards more the infection phase, more on resolving, more like the calming herbs, melissa, lavender, passion flower,
curcumin, ginger,
or those classic kind of anti-inflammatories, spirulina, NAC potentially in that active phase as well, selenium, zinc. Yeah, great.
Yeah, and then, we haven't discussed what's going to happen afterwards, right? That you've had this infection, it's in your lungs, and you've done some damage. And so once we've got resolution, now we need to really think about how are we going to repair lungs. And nobody's ready to think about it yet, but you should be getting ready to think about that, because there's going to be a lot of that coming at you.
Mm-hmm.
So I think rhodiola, ginseng, spirulina, those sorts of things, nettle, a lot of things you can be doing to repair lungs.
Mm-hmm. Yeah, good stuff. Let me jump back to the practitioner questions. So you mentioned that ACE2 receptors are actually found in the lungs and the heart, but they're actually also in the CNS, or the central nervous system. What types of symptoms are being reported, and what can we kind of look for in terms of those CNS manifestations?
Yeah, I actually looked this up because I wanted to make sure that I got everything correct. According to reports from China, more than a third of patients with severe disease have altered consciousness, evidence of skeletal muscle damage, and acute cerebral vascular disease, which suggested CNS symptoms. And the symptoms that they were looking at were viral meningitis, stiff neck, muscle ache, severe headaches. The hard part is that you have to separate this away from virus effects like hypoxia and metabolic abnormalities that you're going to see just by blocking in the lungs. But it certainly looks like there were some strong CNS effects in a third of patients. That's a lot.
Wow. But these were end-stage hospitalized patients at this point, right?
These were end-stage hospitalized patients, yeah.
So not necessarily seeing early stages of any of these kind of symptoms, or
hard to say, right?
Yeah.
Their testing was just like ours. Initially, they didn't have any, so we don't know.
Yeah. Question around, this is interesting, the immune boosting effects of an herb. How long would they last? Some say no longer than 6 minutes. I'd never heard that.
That's because it isn't true.
Right. What's kind of the life cycle in terms of half-life or like effect on the body on some of these herbs?
So pharmacokinetics of most of these herbs hasn't been done, but the pharmacokinetics of cytokines is known. So if the herbs are inducing cytokines are around for 18 to 24 hours. So that's 2 days. Now, if you have the herb being around for any period of time, let's say 12 hours, you've got 2.5 days. 6 minutes, I don't know where that's coming from, but that's not how a cytokine works.
Okay. Thank you for that. That makes sense. Safety around children, safety around some of these compounds and the use in children. I know elderberry, for example, is pretty safe. Mm-hmm. Thoughts on some of these other herbs?
For kids, I don't tend to go herbs first. I tend to go more probiotics and food and sleep and those sorts of things, because we haven't tested most of these herbs in kids. However, certainly Echinacea has been tested in kids, and it shortens the duration of colds in half. And hypothetically, that would be true for this as well, since coronavirus used to cause colds. So Echinacea would be safe. Elderberry would be safe. Astragalus appears to be safe in kids. Kids being 6 years old, hasn't been tested in younger. But yeah, I think a lot of these things, Melissa is safe in kids. Melissa officinalis, lemon balm. So a lot of these things are safe in kids. Mm-hmm. I worry more about people who are on medications and just making sure that you're not having drug-herb interactions.
Yeah, makes sense.
Oh, and play. Kids should be playing.
Play. And relaxing, not being so stressed out and freaking out. Right. Stressed out parents. question around the flu shot and viral interference. There was that study that was done, I guess it was published in the Vaccine Journal around military. This was a military study that the flu vaccine this year potentially is causing viral interference with corona.
Hadn't heard it.
Yeah, that was something that I added to the list that came up yesterday. Yeah, I had seen that, so I can send that to you. Let me know what you think. But yeah, apparently, and I don't know if it was necessarily COVID-19, or all coronaviruses potentially causing interference.
Is it the shot or is it the strain B flu?
It's the shot.
Yeah, I'd love to see it.
Yeah.
See if I can figure out mechanism.
So yeah, a question on ways of boosting the adaptive versus the innate immune system. You know, a lot of the inflammation that's happening is the early stage inflammatory cells, like the natural killer cells, right? So getting out of that into the adaptive phase, where you're starting to do more antibodies and the body's able to get a hold of the virus is key. And younger people do that faster, older people do that a little bit slower, which is why they're kind of in these cycles, right? So natural ways to stimulate the adaptive immunity, other than, I guess, a vaccine, is probably the best way to stimulate the adaptive immune system, right?
Yeah, vaccine is probably the most effective. Herbally, the same herbs that are going to drive a pro-inflammatory response are going to take you straight into a Th1 response, mostly because of the particular pattern recognition receptor that this virus binds to. It's a TLR7, and so it's going to take you into a Th1 response automatically. The reason that the immune response is longer with this virus is that we haven't seen it before. So, and then with elderly, as you go through immunosenescence, your number of T cells and B cells available to respond is lower. So, yeah, it's longer with them. It can be up to a month.
Question around homeopathy. Got a couple of these questions, and any data on its use during the Spanish flu?
I don't have anything.
Yeah.
This isn't my area, but I absolutely suggest that you interview Paul Herskew. You know, he's got the homeopathy chops and the epidemiology chops, and so he'd be a great person to talk to about this.
Yeah, I'm gonna reach out to him. So, question from someone, general public, was around what herbs, foods, or essential oils should we avoid at this time that could maybe induce a cytokine storm? Which ones can decrease the cytokine storms? Keto, good or bad? We kind of covered keto already, but anything that you would definitely say this is a no in terms of driving IL-6 or IL-1 way too fast or too hard.
So herbally, there is no evidence of any herb causing a cytokine storm, ever. There is infectious disease causing cytokine storms, toxins, viruses, those sorts of things. There's genetics causing cytokine storms. There's vaccines causing cytokine storms, but we don't have any evidence of any herbs causing a cytokine storm. So is there anything that I would absolutely avoid? I would avoid anything that's not organic, anything that's proprietary, and they won't tell you how much is in it, because dose absolutely matters. Anything that's not third-party tested, so that we know that, you know, there's no heavy metals in there. But in terms of, is there some herb that I'm afraid of that I'm going to be like, dang it, shouldn't have taken that? Not really.
Yeah, because they're also modular, right?
Yeah, because they shift on the microenvironment. Yeah, so there's nothing that I'm really worried about there. And I think we already talked about ketosis. Was there one other part of that question?
Essential oils.
Oh, essential oils. Well, again, so you can probably tell, Melissa officinalis is one of my favorite herbs. And so lemon balm it up. You know, not only is it going to make you feel happier because of that joyful lemon smell, it's antiviral at multiple stages in the viral life cycle. And it calms the NLRP3 inflammasome. It seems like you've got the triple whammy there. So
even inhaled as an essential oil versus ingested, even
yeah, you know, It hasn't been studied as essential oil as an antiviral, but it has been studied as tea. And so even at very, very low doses, in fact, the entire mint family at very low doses is antiviral.
Mm-hmm. Wow, great. All right. Balm it is.
Yeah.
I think we covered a lot of the big ones. There's some questions here. I want to give you some time to talk about some of your other projects as well. I see.
Oh, I want to talk about the NK cells.
Yes, natural killer cells.
There was a question about NK cells.
Yes, yes.
I want to talk about NK cells mostly because this is your perfect time to use your mind-body therapies, right? Increasing NK cells is easily done with mind-body therapies. Meditation, singing, music therapy, art therapy, like all these things you can do with your kids, and increases NK cells, which are antiviral, absolutely should be doing that. And also good for your microbiome. So think about all the mind-body therapies you have access to, relax a little, and drumming increases NK cells, right? Singing and listening to other people sing with you, so singing in a choir increases NK cells.
Not right.
Yeah. What?
Not right now, though. Maybe virtually.
Oh, virtually. Yeah, I was just watching it on the news this morning, like kid playing guitar with his grandfather, and grandfather is recording and he's, playing guitar. Perfect. Absolutely. So yeah, so do those mind body therapies and increase your NK cells.
Awesome. Great advice. Let me look at these questions real quick. Let's see if I can get any literature around herbs that modulate ACE2?
Not that I have seen, but I'm an immunologist and ACE2 isn't my area. I've learned it for this disease. So maybe a pulmonologist would be able to help you with that.
A couple of questions on sea buckthorn and oregano oil. And
Yeah, you would think, for as much as we love oregano oil for antiviral, certainly it appears to be antiviral, but there's not a lot of literature on it. I've looked at it, and it does decrease the NLRP3 inflammasome because it has rosmarinic acid in it. But there's just not a lot of antiviral studies on it. I mean, we've used it traditionally, for years and years, just not a lot of research. Same with, I believe there was a question on olive oil or olive leaf.
Olive leaf, yeah.
Yeah, olive leaf. There's one solid study out of New Zealand showing that it works better in women than men, especially athletes. But it only reduced the antiviral response by 28%, whereas a lot of the antivirals that we're talking are decreasing the length of infection by 4 days or more. So of all of the things I would give, I probably wouldn't turn to olive leaf first. I'd probably go to some of the other antivirals.
There's also a question on sea buckthorn. Someone had sent me a study that in Korea, they were using some bacteria, some probiotic on sea buckthorn that is potentially very beneficial.
Yeah, entirely possible. Like I said, I think there's going to be hundreds that are going to come out as beneficial. We just don't know what they are yet.
Yeah. Is Tylenol safe? We kind of touched on that. If I take Adderall, is it dangerous for me to be taking zinc and other vitamins and herbs? Never thought of this before. Adderall and any interactions with these herbs?
So again, this is where you're going to go to your naturopath. Zinc, there's no known interaction. However, depending on the herb, you could increase the detoxification pathway and your Adderall may not work. Or you could decrease a detoxification pathway and all of a sudden your Adderall is doing too much. So you really want to talk about the drug-herb interaction because a lot of these herbs do interact with cytochrome P450, 3A4, or 3AY.
And then they increase the excretion of the drug. And so, yeah, you need to monitor dosing there.
Absolutely.
I think that's your interesting question on any test clinicians can use that you're aware of that evaluate the health of the immune system for patients.
Yes. I wrote down the names of the companies. Well, first of all, you may be aware that hyperferritinemia comes along with infection. And so what the Chinese were doing before they had any tests is they were just checking ferritin levels. So that's one thing that you should be able to do. And then there's a company, I think it's called something diagnostics, and they have a test for cytokines. where did I list these companies? Because I did.
Diagnostic Solutions.
That's it. Diagnostic Solutions has a cytokine test that you can do. But if you're just now, like you're going, I don't, I can't get a hold of coronavirus tests because I know that they're expensive for docs to buy, and you have to buy them in groups of 50, and this is ridiculous. They should be giving them to you free, but they're not. Anyway, hyperferritinemia is what they're screening for. The big issue is that you need fast tests, and I have no idea how long these tests take. Tests that come back in 4 days when somebody has an infection is not ideal.
Right. You want instant testing at some of these centers potentially.
Exactly.
Okay. Well, thank you so much. I think we covered it. We're almost out of time. This was really beneficial for me personally. I mean, I'm a huge fan of yours since forever. I'm a fanboy of Dr. Zwickey. So this has been really great for me, and I hope really beneficial for people listening as well. Anything you want to talk about or plug? Where can people learn more about you, or where would you like to send people?
Yeah, so we're in the process of reviving my website, which is just heatherzwickey.com, so that I can answer questions for people. Anything I want to plug, I just want to plug you guys, really. Thank you. You guys are on the front line, and you often don't get the accolades you deserve because you're not in the conventional world in an emergency room. But I know you're stressed. I know you're seeing patients, and you just need resources, and I hope I can be there to help you when you need help.
Thank you so much. That's amazing. This has been so great. Thank you so much. I'm gonna hopefully this is being filmed, and I will post this to my story, so it'll be available for 24 hours, and then I'll try and send you the recording directly as well. And
That'd be
then
great.
I'm gonna listen to it a couple of times and come up with some key points to kind of get people as well.
Sure. And if we need to do more as we learn more, we can always do that.
Oh, thank you so much. All right. Thank you, Dr. Zwickey. Take care.
Thanks. Bye-bye.
Bye.